Hi, my name is Eleanor Tatum, and I'm the publisher and editor-in-chief of the New York Amsterdam News. The coronavirus crisis has brought serious distress to local economies and advertising along with them. The New York Amsterdam News has partnered with the Local Media Association during this unprecedented crisis. Help us continue our important work in chronicling the life of Black New Yorkers, and consider making a donation to the COVID-19 Local News Fund today. Go to givebutter.com/Amsterdam News. Again, that is givebutter.com/Amsterdam News. Thank you and stay safe.
It's Thursday, April 14th, and welcome to the New York Amsterdam News Podcast. I'm Cyril Josh Barker. We continue our coverage of the COVID-19 outbreak with my guest, Dr. Wesley Willis, who's going to talk about being a healthcare worker on the front lines during the coronavirus pandemic. Well, what is it like being a healthcare professional during COVID-19? The thousands of people working in medical facilities are considered heroes, working every day to treat people with the coronavirus while putting themselves at risk. In the past 2 months, more than 9,000 U.S. healthcare workers have contracted the coronavirus, according to the CDC. As the number of COVID-19 cases continues to rise and more cities begin to loosen stay-at-home orders, healthcare workers say they're ready for the work that's ahead. And we welcome you to this episode of our podcast, and we're so happy to have Dr. Wesley Willis with us today. He is a nurse and a mental health professional, and he's also somebody that I've known for a number of years, and we'll get into that when we start the interview. He's a phenomenal nurse, and he's going to give us an inside look into what it's like being in the hospital, being in healthcare facilities during this pandemic, and he's also going to be giving us some great advice about what we should be doing during this time. He's also a therapist and social worker, so he's going to be talking about that. Well, it is Thursday, and the paper did come out today, and we have several stories that I want to go over. First, our front page story by Stefan Johnson is about how activists are saying the city is still falling short when it comes to how the homeless are being treated during the pandemic. I also have a story about the millions of people who are still not gotten their stimulus check and the roadblocks that some of them are facing getting their federal dollars. We actually spoke to one woman who had her tax refund offset back before the pandemic started, and she actually got that money back after making some calls and being very diligent. And if you are facing that problem, we give you the instructions on how you can get your money back as well. The December 12th movement is honoring the 95th birthday of Malcolm X on May 19th, which is Malcolm X's birthday, with a motorcade through Harlem. We have some information about that. It's actually going to be happening the afternoon of Tuesday, May 19th. Also have to make a quick note about our editor, Nyaba Rinde. She has a new virtual town hall that she's been doing on Saturdays that we put on our YouTube channel called COVID and Us, and you can catch that on our YouTube channel. Just type in New York Amsterdam News in the search, and you can see that there. We actually have 3 episodes, and she's going to be doing more of those and having more of those come up soon, so be sure to watch out for those. Well, my guest is Dr. Wesley Willis, who is a nurse and mental health professional. He's been on the front lines during the COVID-19 pandemic and is with me on the phone to discuss his experience. Welcome to the podcast, Dr. Willis. How are you?
Good morning, Mr. Barker. I'm doing well. And you?
I'm doing great. Thanks so much. Well, first and foremost, I have to give you a heartfelt thank you to you because of all the work that you're doing as a frontline worker in the health profession. I know that you've been working long hours, making sure that our folks are safe, that they're getting healthy. So first and foremost, thank you so much.
No. Thank you, and thank everyone, all of the New Yorkers who are following the guidelines of staying socially distant and at home during this really tough time. I mean, it's taking all of us really working together to kind of flatten this curve, as the governor has said, and really just make this thing go away, hopefully, as successful as we can be.
And I have to do a full disclosure on the behalf that you and I have known each other for a long time. We've known each other about 15 years. We went to college together. And yes, your sister also graduated with me. And I just want to, because I have to let people know that Wesley's been a big help to me in some aspects, navigating with me different mental health services. So I just want to put that disclosure out there that we do know each other. Well, first thing I do want to ask you is tell us what it's like on the front lines. We're seeing the news stories. We're seeing some of the good stuff, some of the bad stuff. What are you seeing?
On the front lines, it's actually been really tough. I'm gonna own that part of it. I think we have gone kind of like through this continuum of like this unknown to doing different trials and understanding really how this disease progresses. And now we're kind of like on this kind of dovetail where we've seen, like, again, those numbers don't go down. And we're feeling, I think, much more comfortable in being in the front lines and knowing that, some rules we learned from the road along the way.
Interesting. And tell us what a typical day is like for you, because what we're seeing on the news are healthcare workers in scrubs wearing masks. We're seeing all these patients, some we've seen some video inside some hospitals and some healthcare facilities. What is a day like for you? Like, how many patients are you looking after, taking care of?
So, yeah, a typical day does consist of masks. We have to be protective and smart during this time. I think a time that we've never had, or not that I can recall in my 17 years in healthcare, that we've had such a really kind of concern every day for our own, safety and the safety of our patients, and that we have to, really be thoughtful and protective, like wearing masks and gowning and gloving and covering our head and shoes appropriately. So that, that's very much a part of our regular day, and I can't ever, like I said, ever say that I've ever had that a part of my regular kind of practice in being a nurse. But yes, so we've seen those numbers go down. I've ranged from taking care of 4 or 5 critically ill patients to now to the standard 2. Because we've had kind of a decrease in the number of individuals and in the healthcare system and in the hospital.
And one of the things that's a hot topic right now, of course, is the number of Black people who are suffering from COVID-19 and passing away from it as well at astronomical numbers. What's your take on it? What are you seeing? Is that true? Are there a lot of us in the hospital that are getting treated? What are you seeing?
So, yes, I do work uptown Manhattan, and I've worked in hospitals in the Bronx, and I've worked in hospitals in Brooklyn. And I think that even before now, to be just really transparent about it, I think that the communities that are largely minority have not always had the best health care and the best options available to them. And I think that this really brought that to light. Those facilities already were understaffed or poorly staffed. You go into kind of like this pandemic where you now need double or triple the number of staff to meet the needs, and you were already behind, kind of behind the 8 ball, for lack of a better word. You just kind of try to make do. And so I think that's what we see is like, so again, largely those individuals in ethnic minority communities. I recall, like, just even several years ago, a hospital on a regular medical surgical unit, a nurse caring for 15 patients. And that, in the 2000s, so you think about kind of like that, where would that hospital be today? I pray hopefully that same one nurse will not be caring for 15 possibly positive patients who are going to go through this potential crippling disease. I think that, yes, what we are seeing is ethnic minorities. I'll be honest. I think that, a lot of us as ethnic minorities also have larger body weight. So we're not the typical ideal body weight, which we are realizing, I think, is that this thing kind of is difficult to fight when you have larger amounts of adipose tissue and, some chronic diseases like diabetes, heart disease. So, yeah, that is very much the reality of it.
All right. And I think what people would like to know is what does it take to be able to treat someone with COVID-19? Not just one, but you're treating several people at one time. What does that look like? Like, what is the day-to-day, are you monitoring people? Are you administering? Like, what's the day-to-day for you?
Yeah, so we're still, I feel like, a bit in the trial and error. We've just several weeks ago started giving patients what we call COVID plasma. And so that's kind of like, just basically like you give a patient blood. And this would be plasma with antibodies, with COVID antibodies or coronavirus antibodies. Again, we went down the line of trying the hydrochloroquine. That was a standard in giving ascorbic acid, which is vitamin C, and thiamine. So these vitamins, and then doing Remdesivir and the other antiretroviral that's believed to be useful. And, with mixed results at the end of the day. So we're still very much kind of in the experimental phases of this thing.
And all the time we're seeing from Governor Cuomo about the hospitalizations going down. You've been in the medical profession the entire time during COVID-19. Do you see a difference between 2 months ago and now with the number of people that are coming in?
Goodness. Yes, I mean, one day reportedly in the emergency room, there were 5 patients for the whole entire shift, which is like, 8 to 12 hours. So yes, there is definitely a decrease in the usage of the hospitals. I think that also that presents another difficult conversation is where are people who we used to have coming in with heart disease that are experiencing kind of cardiac issues and all of the other issues. Yes, we know elective surgeries were either canceled and or really kind of put on hold unless it was kind of urgent or emergent. But kind of where are those other folks who have these chronic illnesses that were being managed in the hospital when they became acute? Are they just staying at home, or we really don't know that data.
One of the things that I mentioned in the intro of this episode is that we've had thousands of healthcare workers who have actually contracted coronavirus through their work, and we're constantly hearing different things about there's not enough PPE or that we have enough PPE within our healthcare system. Do we have enough? Do you feel protected as well? I mean, do you feel safe? I mean, what are your thoughts on that?
So personally, from my own experience, yes, I do. I have had the appropriate equipment that I needed to care for my patients. I have felt comfortable, in doing the work that I do, and that I'm gonna, have some reasonable sense of safety. I have colleagues who work at different hospitals who have no reason to lie to me and have stated that they don't. And they work in different places like the emergency room. I mean, I've had colleagues of my own who died, who I worked side by side the day before, and was told the next day or in 2 days that they were no longer with us. And I've had another colleague who was an emergency room doc, and he passed. And it was, it's definitely been tough. And I don't know, again, what his experience was, the ER doc who passed, but I do know the one who worked side by side with me. We had access to the same things. But then again, there are so many other layers that could have, added to kind of his unfortunate loss.
Yeah, and these are people that you knew who passed away, right?
Yes.
Oh wow. And that kind of brings me into my next question, because one of the things that we're seeing now is, and you're a mental health professional as well, I've said that before.
Yes.
What are your thoughts on some of the mental health aspects that nurses and healthcare professionals are going through? Let me give you an example. My sister is actually, she's not a healthcare professional, but she's what I would consider, and she is an essential worker working in the hospital. She works in the food service area. And so she, has told me some things that, obviously she's not in the room with the patients, but she's told me about the environment that a lot of people are seeing that are on those front lines. And we're also hearing stories about some of the mental health anguish that a lot of our frontline medical workers are going through. What are your thoughts on that? And as a mental health professional yourself, what's your message to those on the front lines who might be going through some mental anguish? Because we're talking about a lot of illness, a lot of death, a lot of having to go beyond yourself because there are people who are dying, and in most situations, the person's family can't be there, and you're there. So what is that like? What take us through that?
So yeah, we were thrust into this thing rather unexpectedly, and to quote some nurses and some healthcare professionals, it was like wartime nursing. It was just kind of really, really pulling together our resources to try to manage this thing. So I do have colleagues and myself even that have experienced a great deal of anxiety when this thing started. I know colleagues who, expressed the just grave concern about possibly getting their parents who they take care of who are elderly sick, or getting their children sick, and that being kind of estranged from them or distant from them at this point in time, again, so that they can work and not have that guilt of going home. And that is, that's quite a layer. And then the other part is one's own self, the trauma that comes with, potentially the loss of self. So one's own kind of like one's own possible demise in this whole thing. I think that it has created a level of trauma for nurses who already, were probably borderline, and I mean some who weren't. I mean, so I personally myself have buried or placed in a body bag 4 patients within a shift, within less than 4 or 5 hours, and being somebody who I prided myself on, I'll be honest, before all of this, and saying, "Hey, I've never lost a patient in this particular span of my career," to now that being the reality of it all creates a bit of mental challenges. So what we're seeing is basically trauma that is happening for these nurses, again, related to the fear, going home, could I have done more? Should I have done more? What could I have done differently? And I mean, I think that it's definitely going to need some serious attention after all of this is done, if it is done, is the question.
What are you hearing about what's next? Because we're hearing different news reports that there's a possible second wave, and also we're hearing about the children and the young people who are suffering from that respiratory disease that could be possibly caused by COVID-19. What are your thoughts on that? Have you seen any young patients in your hospital that are dealing with that?
So in this kind of new hypothesized thing like Kawasaki's, I personally haven't taken care of a patient. I know I have colleagues who have. I think throughout this whole entire thing, I've had young patients, again, in their 20s and 30s who were COVID positive. So that whole idea was that I think initially was like young people aren't going to get it, it's going to affect the elderly. I think that is true. Yes, disproportionately more so. Elderly are more likely to have chronic illnesses, but we were and still continue to see young people who are really affected by, this diagnosis.
Okay. And what are you hearing about what's next? Because, again, we're hearing about a second wave that could happen. What are you being told about what's ahead?
So I think that, yes, we definitely are going to see a second wave. We joked kind of half-heartedly, but knowing that it's true, that while they say there's going to be this second wave, we think is going to be a true dichotic notch. And that's just kind of anecdotally speaking, that when you look at a dichotic notch, you have kind of like this peak, and then on a waveform, the second peak is higher than the first one. Right, I think that, if we aren't careful and we aren't thoughtful, then that we run a great risk of seeing a resurgence in this thing greater than what we saw before. I applaud Governor Cuomo for being actually thoughtful and slow about reopening the city, because I think that is definitely the smartest thing to do. But I do think it's going to be challenging for us as New Yorkers. Riding the train, me being an essential worker and riding the train is significant and important. I have other options, but what about those who don't?
Right.
So again, are we going to allow ourselves to be back kind of like in that same boat? We really can't afford to go back to where we come from, basically.
One of the things I do want to ask you about is you are a mental health professional as well. You are a therapist.
Yes.
And while I have you on the phone, I do want to talk to you about what people should be doing. You actually said something on Twitter yesterday, and you had on there practicing acts of self-love. Can you talk about what that is and what that means?
Yeah, so again, just thinking of healthcare, our own healthcare professionals, there has been a sense of like that being self-care is in a way of being selfish, and that's furthest from the truth. Yes, there is a sense of selfless acts that I think drives the inner kind of professional for nurses, but thinking of yourself first isn't selfish. There was a nurse actually who, I guess you can't say that she did die because of what she did, but she coincidentally, a charge nurse, went in to do chest compressions on a patient who had declined very quickly without the proper equipment. So chest compressions and knowing the risk of exposing herself to coronavirus, and she died 14 days later. I think that, me being a nurse myself, again, just kind of thinking of selfless, like I have a patient who's deteriorated, decompensating. I have a responsibility to go in and save this patient. And that being kind of like the gut reaction that we would do in the past, but now, we don't have that. So that kind of, again, being self-love, being thoughtful, about what you need to take care of is going to be some of the very kind of important medicine, basically, for your own mental health. So that, and I mean, again, behavioral activation that I've talked about, getting up, getting out. Yes, I know we're socially distancing, but getting outside doesn't require you to be within 6 feet of someone else. So getting some sun, walking through the park, again, that behavioral activation that gets kind of like the adrenaline going, and endorphins are going to be really important for individuals who are kind of like held up in the house, for lack of a better word.
Including myself, so absolutely, I agree with that. Lastly, I do want to ask you, what is your message as a healthcare worker on the front lines to everybody? A lot of us are at home. Some of us are essential workers. There's some people out there who are just trying to make it. And one of the things I say about COVID-19 is that it also exposed a lot of disparities, which you talked about, but there are a lot of people who are just going through a lot of different things at one time. But what is your message as a frontline healthcare worker to everybody?
So my message is know that, no one comes from a place of kind of completely knowing this thing. I think that we look for like these answers, and that somebody knew something that I didn't know, and somebody failed to do something. I think this particular thing is just to remember that no one knew, that this is a completely unexpected kind of issue that happened in our lives, and that patience is key. So patience is really kind of the virtue in this, and I think that we don't have quite a great handle on being patient and being understanding. So this is really pushing everybody, beyond what they used to, and then just know that in that unknown, just kind of lean on your own understanding and common sense. I think that, that common sense definitely is going to play a huge part in this.
All right. Well, listen, thank you so much, Dr. Willis, for being on the podcast. And again, thank you for being out there on the front lines and making sure that everyone is okay.
Thank you. It's been a great pleasure.
That concludes this week's podcast. You can pick up the latest edition of the New York Amsterdam News on newsstands. and get updates online at amsterdamnews.com. You can also keep up with us on Facebook at NY Amsterdam News and follow us on Twitter at NYAmNews. I'm Cyril Josh Barker. Thanks for listening.
Hi, my name is Eleanor Tatum, and I'm the publisher and editor-in-chief of the New York Amsterdam News. The coronavirus crisis has brought serious distress to local economies and advertising along with them. The New York Amsterdam News has partnered with the Local Media Association during this unprecedented crisis. Help us continue our important work in chronicling the life of Black New Yorkers, and consider making a donation to the COVID-19 Local News Fund today. Go to givebutter.com/Amsterdam News. Again, that is GIVEBUTTER.com/Amsterdam News. Thank you and stay safe.